Today, though, he's travelling 4,000 miles. There was a time when people who fell ill abroad would fly home to get treated by the world-renowned NHS. Today, patients like Barry are going in the opposite direction. Fed up of waiting lists in Britain, he's having his hip replaced in India. He booked the trip through the Taj Medical Group, a UK agency that specialises in arranging private medical care abroad.
India's first internationally accredited hospital.
Yes, it is.
Yeah.
This is the Apollo Hospital in the country's capital, Delhi.
Lovely and cool.
And this will be Barry's home for the next 3 weeks. It's a long way from his real home in London, but he says the continuing pain in his hip left him no choice.
The timescale was far too long for me. 6 months was the waiting list for the operation. I had to wait 3 months to see the consultant. And with the hip getting worse, I really needed to tighten up on that time, big time.
Can you bend your hip, try and touch it with your tummy? Okay.
And after less than 1 hour in India, he gets what he paid for, an examination by the consultant.
Can you do that? Can you touch it to your tummy? You can't. Can you?
No,
No.
get the pain kicks in there.
Okay.
that
And
Dr. Gulati will be performing the hip replacement. It'll cost just a third of what it would in a private hospital in Britain. And this bill includes the flights and the 3-week stay in hospital. Like Dr. Gulati, many of the doctors here have trained in the UK. The nurses too match the best international standards. And as for the numbers, there's one to every patient. Luckily, they're relaxed about visitors. Hello, Barry.
Mark, how are you? You well?
How are you?
I'm very well. Now I'm having something to eat.
So first impressions?
First impressions, terrific. I can't fault anybody. There's so many people falling over themselves to make my stay good here that I just feel like a king.
You're feeling it was a good move.
Absolutely.
And Barry needn't feel alone, because there are other Brits in the hospital too. Karen Holman travelled from her home in West Sussex because she couldn't get her NHS knee operation done quickly enough. What happened? You were waiting and in pain, weren't you?
Yes, I was.
It was unacceptable.
Yeah, absolutely unacceptable. Been waiting for about 6 months. Excruciating pain, not just sort of in the day, but night times and everything else. And by the end, really on crutches.
So how long were you to be left in pain on the NHS system?
They didn't
Don't know.
say, no.
Didn't say.
They couldn't give any idea at all.
No.
Months and
No,
months.
months, I would say. Years, maybe.
But thanks to her £3,500 treatment in India, Karen's now walking without pain for the first time in years.
They've changed my life. Yeah. They've seen me, they've x-rayed, they've used the MRI scan, and then they've operated. And, they did one leg and then the other one started hurting, and they didn't say no, we won't do it. They've actually done that one as well. So they've changed my life.
2 days after his arrival, Barry's had his tests and scans and is now ready to go into theatre. It's the moment of truth. It still seems like a good idea.
Terrific idea. Absolutely.
Well, the best of luck.
Thank you so much.
Good luck. Good luck. I'll see you afterwards.
Okay.
Unlike many NHS hospitals, the Apollo is free of MRSA and other superbugs. It's one less reason for Barry to worry. And it's just as well, because the local anaesthetic means he'll be awake throughout.
Peter, you want to say hello? Are you comfortable?
I'm very comfortable.
Great.
The medical team have discovered further deterioration in Barry's leg since his last X-ray in Britain 4 months ago. It means Dr. Gulati is having to perform a full rather than partial hip replacement.
Yesterday I told him good luck, and he told me I don't like good luck, I did good skill. I thought it was very well said. Okay. I trained my joint replacement surgery. I trained for that there in the Liverpool area, and I must give my tribute to the British system, where they have trained me to a level that I can do it here on one of your patients. So I think it's a great example of symbiosis, how we can learn from each other and how we can help each other.
At the end of 3 hours, the hip is replaced and the operation deemed a success. But according to the surgeon, it's come just in time.
What are the consequences of people waiting months and months for the sort of operations you do?
Basically, first of all, pain. And secondly, if they have to wait for a very long time, then things can go worse. Because suppose, even if it is arthritis, there can be too much extra bone formation, there can be more bone loss, and there can be more deformities to occur with time. And so this is the hip that we've done for you. I'm just going to move it.
Back in Delhi, Dr. Gulati is checking on Barry's progress as he recovers from the operation.
Okay, and so that's fine. All well? Great. You did very well.
Didn't feel a thing.
You didn't feel a thing? Hi, Elliot. How are you doing?
Okay.
Just days previously, the doctor had also operated on 14-year-old Elliot Knott from Dorchester. 9 months ago, an ice skating accident left his spine deformed, and Elliot was unable to walk without pain or attend school. The NHS classed his situation as non-urgent and told him he'd have to wait a year for treatment. But now, after a 6-hour operation in India, Elliot's able to walk again.
How are you feeling?
I'm fine, like there's hardly any pain now, just like where the scar is, but well, even now it's a lot better than like before the operation.
What were you having to live with before the operation?
Like before, as soon as I stood up, it like hurt, and like I had to sit down like nearly all the time, and I couldn't like walk nearly. I couldn't even like walk around town without it hurting.
What's it given you back coming here?
Like I can walk again and just like even stand up, and I'll be able to go back to school now, which I didn't.
Morning. Miss Peters.
Yeah.
I'm happy to see you standing.
I'm happy to see me standing.
But back in India, Barry Peters has no complaints. He's so satisfied with his treatment, he's planning to have more.
There's no downside at all. None whatsoever. You've got fantastic facilities here, all the most modern equipment. You've got very highly trained doctors here. We're swamped with staff here, which is what you don't get in the NHS. We're swamped there. Number of people that come in to see you every day to check on you is fantastic. You can't fault it.
So you're recovering from the hip operation, but now you're going to have dental work done as well.
That's right. It's these teeth hockey injuries, teeth knocked out. This crown came out quite some while ago now. These 2 chipped ones need tending to again. So yes, I just want a nice line of teeth back in here, which they will do in the hospital within the next 10 days, I think.
And is that going to save you money?
Oh yes, the total cost of coming here for hip and teeth is less than the cost of the teeth in the UK.